You are standing in front of the mirror, and you notice it again, that twisted cord running up the back of your calf, darker than it should be, slightly raised. When you touch it, there is that familiar heaviness underneath, that dull ache you have learned to ignore. The visible veins are only part of what you are feeling. It is the tightness in the leg at the end of the day, the swelling that shows up after you have been sitting too long. Here is what almost nobody tells you. Varicose veins are not actually a vein problem. They are a system failure. And that system has 5 specific, addressable causes. What I am about to share changes that question completely, because once you understand what actually created this, you will understand exactly what to do about it starting today. If this kind of clear, practical health information is what you are after, I would genuinely appreciate it if you subscribed and turned on notifications. That subscription is how you stay connected to real answers about the health questions that matter most at this stage of your life. I'm Dr. Gerald Mark, and in my practice I have watched varicose veins disappear completely in patients who thought surgery was their only option, not because the veins magically vanished, but because they addressed the actual cause. After 60, varicose veins become increasingly common, especially in women. In women, estrogen levels drop, and in both men and women, muscle mass declines steadily. Less muscle means a weaker pump in your legs, the mechanism that actually pushes blood back up toward your heart against gravity. Most people move through the exact same sequence with varicose veins. Spider veins show up, and you ignore them. The veins become more visible, and you buy a compression cream. The bulging starts, and you finally see a specialist. Surgery happens, and then, 2 years later, the veins are back. That is not bad luck. That is what happens when you treat what you can see and leave the cause completely untouched. I had a patient named Celeste, 72 years old, who called my office after her 3rd vein surgery in 6 years. She was exhausted. She was frustrated. Her surgeon had been excellent. The procedure worked perfectly, but Celeste had never been told why the veins had failed in the first place. Inside every healthy vein, there are tiny one-way valves. Think of them like gates. They let blood flow upward toward your heart and then snap shut. When those valves weaken, blood pools behind them. Pressure builds inside the vessel. The walls stretch. That twisted vein you see under your skin is a valve that stopped doing its job. Now think about the challenge your leg veins face every single day. Getting blood back up from your feet to your heart, that is a climb of roughly 4.5 feet. Your heart has no direct role in that return trip. That job belongs entirely to 2 systems, the valves and your leg muscles. Every single time your calf muscle contracts, it squeezes the vein like a pump and drives blood upward. That is how blood gets home. If either system breaks the valves or the muscles, you get stasis. Blood sits still. Pressure builds. Walls stretch. This is why varicose veins are especially common in people who stand or sit in one position for hours. Surgeons, teachers, retail workers, people at desks. 8 hours with the leg stationary means 8 hours with the venous pump essentially switched off. Your veins are not failing because your veins are weak. They are failing because something is working against them. Celeste was a retired teacher. She had spent 40 years on her feet in classrooms. When the spider veins first appeared on her legs about 10 years earlier, she barely noticed them. They were small, purple, web-like patterns, just under the skin. Over the next few years, the spider veins became more prominent. Then the larger, darker varicose veins started appearing, twisted cords along the back of her calf and up the inside of her thigh. By the time she was 68, she felt a heaviness in her legs by evening. She started wearing compression stockings. She thought that was her solution. Her doctor referred her to a vascular surgeon. The procedure was successful. The veins were gone. The swelling decreased. The heaviness lifted. For about 14 months, Celeste felt genuinely better. Then, slowly, new veins began appearing on the same leg. Celeste was devastated. She felt like her body had betrayed her. She had done what the expert recommended. It had worked. And it had failed anyway. That was when she came to see me. The first thing I told Celeste was this: your surgeon did an excellent job. The procedure was technically perfect. The reason you have new veins is because the system that created the first set of veins was never addressed. There are 5 specific causes. The organs in your lower abdomen, your intestines, your bladder, your uterus, if you are a woman, sit directly above the major veins that drain your legs. When the organs above that highway are chronically bloated, they press down on those veins. Chronic constipation, irritable bowel syndrome, heavy lifting with breath holding, All of these create pressure that forces blood backward in your legs. Most people have completely separated my digestion problems from my vein problems in their minds. They are not unrelated. Constipation is not just uncomfortable. It is structural pressure, acting directly on the vascular architecture of your legs. When Celeste told me about her digestive history, the picture became clear. She had struggled with occasional constipation for years. What she did not realize was that every day of pressure from a bloated bowel was compressing the veins that were supposed to be draining her legs. The second cause is something you were born with and something you have been making worse without knowing it. Vein walls are made of collagen and elastin fibers, the same proteins that give your skin its elasticity. Chronic, low-grade inflammation in the surrounding tissue, usually driven by diet, is a major factor. Sugar, processed vegetable oils, and trans fats all contribute to inflammation that slowly erodes the structural integrity of your vessel walls over time. The second accelerating factor is bioflavonoid deficiency. Bioflavonoids are plant compounds that directly reinforce the vein wall and reduce inflammation. They are found in blueberries, black currants, tart cherries, chokeberries, citrus fruits, and buckwheat. When your diet is low in these foods, your vessel walls literally lose their reinforcement. You are asking your vein walls to hold pressure without giving them the materials they need to do it. When I tested Celeste's diet, she ate very few of the bioflavonoid-rich foods that would have been protecting her vessel walls. The third cause is something you are doing every single day and almost certainly do not recognize as a problem, and it is probably the easiest thing on this entire list to fix, starting tonight. It is called blood viscosity. Thick blood moves slowly through your veins and builds pressure on the walls. The single biggest driver of blood viscosity in otherwise healthy people is dehydration. Not severe dehydration, chronic, mild underhydration that most people carry around without realizing it. Most adults over 60 drink far less water than their bodies actually need. A study published in Thrombosis Research followed 280 adults over 60 for 12 weeks. One group increased their daily water intake to 30 milliliters per kilogram of body weight, roughly 2 liters, for a 150-pound person. By the end of 12 weeks, they showed measurably lower blood viscosity and reduced symptoms of heaviness and swelling. Hydration is foundational medicine. Celeste's water intake was shockingly low. She was drinking about 5 ounces of water per day. Her blood was moving like molasses through her veins. Before we go further, I want to hear from you directly. Drop a yes in the comments if any of this is resonating. Also, drop your age in the comments. Just the number. It shapes exactly which recommendations matter most for where you are right now. The fourth cause is the one that determines whether everything else works. Surface veins in your legs drain into deep veins. These veins travel upward through your groin, become the iliac veins in your pelvis, merge into the inferior vena cava, the body's largest vein, and empty into your heart. Along that entire path, there are at least 5 anatomical locations where external pressure can partially block that vein. If even one of those points is obstructed, pressure builds in everything below it. No amount of exercise or hydration overrides an upstream blockage. The first obstruction point is the groin and pelvic region. The femoral vein passes through a narrow anatomical channel. Right next to it are loops of your colon. If there are adhesions, chronic inflammation, or a chronically bloated bowel, the vein is compressed. The second point is your small intestine. When the small bowel is distended or has dropped lower than its normal position, it creates pressure on the iliac vessels. Chronic constipation, irritable bowel syndrome, persistent bloating, these are not just digestive annoyances. They are structural forces acting directly on the vascular architecture of your legs. The third point is your liver. An enlarged or fatty liver displaces the vena cava and creates partial resistance to blood flow. Fatty liver disease is not only a story about liver enzymes and metabolic risk. It is also a compressive force in your vein circulation. The fourth point is your diaphragm. When the diaphragm is chronically tightened, which happens with prolonged stress, poor posture, and sedentary living, that opening is compressed and vein return is impaired. Most people over 60 have spent decades in poor posture, and that has slowly tightened the diaphragm. When Celeste's intestines were examined, we found significant bloating, mild inflammation in her colon, and a chronically tight diaphragm. All three were creating resistance to the blood trying to drain from her legs. Her surgeon had removed the damaged veins, but Celeste was still forcing blood to climb against multiple upstream obstacles. Of course, new veins developed. The system was still broken. The fifth cause is the one that determines whether everything else you do actually holds. You can address every mechanical factor on this list and still lose ground if your vessel walls do not have what they need to rebuild. The most critical nutritional factor is vitamin D. Vitamin D is essential to collagen production, the process your body uses to build and maintain the structural proteins in your vein walls. When vitamin D is low, your vessel walls become progressively less resilient and unable to resist pressure. The optimal range for vitamin D is 50 to 100 nanomoles per liter. A study published in the Journal of Vascular Surgery followed 340 adults over 55 for 18 months. Those with vitamin D levels below 30 nanomoles per liter had significantly thinner collagen in their vessel walls. Supplementing vitamin D to reach optimal levels actually slowed the progression of existing varicose veins. The majority of adults in northern latitudes fall below the optimal threshold, especially from October through April. If your vitamin D is low, your vessel walls are being built with defective materials. They cannot stay elastic. They cannot resist pressure. This is not optional for anyone with varicose veins. Working with patients on exactly this issue, I put together something I call the 5-system reset. This is the framework Celeste followed, and 2 years later, she has not needed another surgery. The 5 systems are fluid circulation, tissue swelling, muscle activation, mechanical clearance, and structural resilience. Each one addresses a specific part of why your veins failed. Together, they address the entire system that created the failure. Water is non-negotiable. Calculate 30 milliliters of water per kilogram of your body weight, roughly 2 liters, for a 150-pound person. Drink this water evenly throughout the day, not all at once. Your blood viscosity will begin to improve within 3 days. Coffee and tea are diuretics. Every cup of coffee is a reason to add an extra glass of water to your day. Add turmeric to warm food. Half a teaspoon daily. Turmeric contains curcumin, which reduces inflammation in vessel walls and improves circulation. Drink fresh ginger tea throughout the day. Slice fresh ginger root. Pour boiling water over it. Add a wedge of lemon. Pour it into a thermos and sip it evenly. The key is throughout the day. That keeps the concentration of active compounds in your blood stable. Ginger reduces blood viscosity and has a direct anti-inflammatory effect on vessel walls. Reduce sugar dramatically. When you eat sugar, your body stores it as glycogen, and 1 gram of glycogen holds approximately 3 grams of water. Read every label. Hidden sugars are everywhere. Packaged fruit juices, flavored yogurt, bottled sauces, mass-produced bread. Avoid monosodium glutamate and similar flavor enhancers. They disrupt sodium-water balance at the cellular level. Try eliminating dairy for 3 to 4 weeks. For a significant portion of people, casein, the primary protein in cow's milk, triggers chronic low-grade inflammation in the gut that contributes to fluid retention throughout the body. Add foods that support kidney function. Cranberries, lingonberries blended with water, horsetail herb brewed as tea, parsley, celery. In season, cucumber, watermelon, and cantaloupe. This may be the single most important step. Your leg muscles are the pump that drives blood return. There is a persistent myth that people with varicose veins should rest their legs. This is harmful. Controlled physical activity is part of the treatment. Do this 3-part sequence at least 3 times daily. It takes 3 to 5 minutes. First, sumo squats. Stand with your feet wide apart, toes turned outward. Lower yourself as far as your body comfortably allows. Rise back up. 10 repetitions. The wide stance engages the inner thigh and glute muscles that govern vein drainage at the pelvic level. Second, standard squats. Feet shoulder-width apart, toes forward. Lower to about parallel and stand back up. 10 repetitions. Pay close attention to your breathing. Inhale on the way down. Exhale on the way up. Holding your breath raises intra-abdominal pressure and creates exactly the kind of downward force on pelvic veins that makes varicose veins worse. Third, calf raises. Stand upright. Slowly rise onto your toes. Hold for a second at the top. Lower slowly. Continue until you feel a mild burn in the calves. That burn tells you the muscle has been thoroughly engaged and the pump has fired. Walk 30 to 40 minutes per day. Take the stairs instead of the elevator. Walking produces measurable improvement in symptoms within 2 to 3 weeks. If your veins continue to progress, address the mechanical obstructions directly through visceral massage, manual mobilization of the abdominal organs to relieve the pressure they are creating on your drainage veins. Gentle pressure applied to the lower right abdomen can soften adhesions and relieve tension around the femoral vein. Slow circular, clockwise massage over your central abdomen improves intestinal motility and reduces pressure on the iliac vessels. Gentle sustained pressure, just under your rib margin, on a full exhale, addresses diaphragm tension. The changes build slowly. Adhesions that took years to form do not dissolve in a week, but they do respond to consistent daily attention. Get your vitamin D tested. The optimal range is 50 to 100 nanomoles per liter. If you are below that, work with your doctor to correct it. This is not optional. Your vessel walls cannot stay elastic without it. Eat foods that reinforce vein walls: blueberries, black currants, tart cherries, chokeberries, citrus fruits, and buckwheat. 1 cup of blueberries 4 times per week. These are not supplements. They are part of how you live. If a vein becomes hard and cord-like, hurts when pressed, or the skin turns red and warm, see a doctor that same day. This is thrombophlebitis. Here is the distinction most people need to hear. Pulmonary embolism, a clot traveling to the lungs, is a complication of deep vein thrombosis, not surface vein thrombosis. Varicose veins are surface veins. A clot in a calf varicosity very rarely leads to a fatal embolic event. The condition that warrants serious vigilance is deep vein thrombosis, particularly after surgery, prolonged immobility, or flights over 8 hours. Do not ignore warning signs. But do not amplify the fear beyond what the physiology actually warrants. Celeste stayed committed to this protocol for 6 months. Her constipation resolved. Her vitamin D reached optimal levels. Her water intake became automatic. She walked daily. She did her squats and calf raises. Her abdominal bloating decreased significantly. 6 months in, the visible varicose veins had noticeably decreased. The heaviness and swelling, which had returned after her last surgery, diminished. A year in, she had not had a single new vein appear. 2 years in, the original veins were significantly less prominent. She did not need another surgery. She changed the system that created the veins. That could be your story. What you just did, what you invested in over the last 12 minutes. Most people your age will scroll past without a second thought. They will see the thumbnail and keep moving. But you stayed. You watched all the way through. You now know something that your neighbors do not know. You arrived here uncertain. You are leaving equipped. You have a named framework, the 5-system reset. You have a clear action plan. You know exactly where to begin tonight. You are not starting from confusion anymore. You are starting from understanding. Picture 6 months from now, standing at that same mirror, looking at the same leg, and noticing that what was there is fading. That is what Celeste experienced. That is what the system produces when you actually work it. You are part of a community now, a real community of people who make the daily choice to show up for their own health and for the people they love. When you share this with someone you care about, someone dealing with leg swelling, or visible veins, or the fear of surgery, you are offering them something real. You are offering them hope that is rooted in actual physiology, not wishful thinking. Subscribe and turn on notifications. This is where you get the same quality of honest, clear, habit-focused health information, the kind that actually changes how tomorrow looks. Drop a comment right now and tell me, what is the one system from the 5-system reset that resonates most with you? What are you starting with tonight? Be specific. I want to know. Small habits, done consistently, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Build one healthy habit today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.